and she has come to us all the way from Kurdistan. She was suffering from very severe scoliosis, and that is a disease in which the spine gets a very big bend. You will be able to see those on the pictures on what a severe bend she had. And the whole spine was jutting out from behind like a hump, and it also made her quite shocked. We have a team here in this hospital, Dr. Hitesh and myself. We tend to operate on these children and help to correct this problem. In her case, she underwent a two-stage operation. The first surgery was done from the front, and in that we had mobilized her spines. And in the second stage, the surgery was done from the back, and rods and screws were applied, and then straightening was done for her. This has realigned her spine, it has given her height, and it has made her much better than what she was before. She's wearing this jacket now, but this is only temporary. In 3 months or so, she will be rid of this jacket. She can walk around now, and she has gained probably 8 to 9 centimeters.
4 inches now.
Yeah,
4 inches.
4 inches of height. 4 inches of height. So it's a big operation, and therefore we would recommend that somebody who has a scoliosis should come to us at an early stage, so that we can treat it with bracing and casting and many other things, so that it doesn't get very bad. Then the surgery for it is easy. In her case, it was a very, very difficult and very challenging case. But we've all come through nicely with her patience and perseverance, with Dr. Hitesh's energies and hard work and my guidance.
Dr. Swaroop had to leave because he is busy in the OPD. So just to add to what he said, basically she came to us at a very advanced stage. So scoliosis is basically a normal bending of the spine, where the spine normally, if you look from the front, it looks straight, it's like a straight column. But in scoliosis, it starts bending to one side, and the patient starts, the parents can notice a big hump on the back, and that is what, when they say that we are noticing a big hump and they are referred to a doctor. But usually, you know, when the patient comes to us in this part of the world, scoliosis is already very advanced. Now, I train in US. They run a school scoliosis screening program where all the kids are screened for scoliosis and they're picked up very early, which makes a big difference to the result. Because once, like in her case, we measure angles of scoliosis. The angle of scoliosis was more than 100 degrees. And once the angle of scoliosis is more than 80 degrees, the surgery gets very complicated. There are risks of paraplegia and all that, but now we have very advanced neuromonitoring techniques, where during the surgery we put wires in different muscles and we know that all the muscles are working normally. So during the surgery there is a person who is continuously monitoring the muscles, which greatly reduces the risk of paraplegia. In this particular surgery, there is a lot of misconception in the general community, even among the doctors, that the patient will get paraplegic. But contrary to that, if we do scoliosis early, the risk of paraplegia is negligible. In fact, there was a study done in US where they said that they asked all the surgeons to do scoliosis, and there was only 1 case of paraplegia in around, I think, 7,000 cases that were operated in 1 year. So the risk of paraplegia is very, very less, and the patients, you can just see from her look, from her parents' satisfaction, that how satisfied she is feeling after this surgery. Even when she came to us at an advanced stage, we took all the precautions, though we had to do this surgery in stage procedures. Like in stage 1, we mobilized the spine, made it loose, going from the front, and in stage 2, we put screws and rods and corrected the spine. She has come out very nicely. You can see that her shoulders are now level. She is sitting straight. And she's looking like a normal girl. You cannot tell that she has scoliosis. And if you look at, if you would have looked at her before surgery, she was looking like this. There was a very, very big hump in the back. And I'm very, very happy with the result of this girl. And I would recommend that all the patients who see, or the parents who see their kids having a hump in the back, they should go to orthopedic surgeon, go to a spine surgeon at an early stage, so that we can get rid of this problem and take care of these kids. It makes a very big difference to their quality of life. It's like a life-changing surgery for these patients.